Our next presentation is from Mary Aspinall. She is a PhD candidate in sociology from the University of New Brunswick, who has worked with us through the Muriel McQueen Ferguson Center for Family Violence Research. Welcome, Mary.
As Peter indicated, I'm currently working on my PhD at UNB, and what I have for you today is presenting a research paper that I did using some of the CDHPI data on the cultural considerations of intimate partner violence offender treatment within Canada. My doctoral research is also following a similar theme, so I will be able to sprinkle in a few results that I'm finding from that as well that I think complement this research study also. So I will begin with a bit of background to the research I'm talking about today. Largely as a result of the policy changes in the 1970s and 80s that mandated arrests in cases of intimate partner violence, the criminal justice system was faced with the issue of what to do with this influx of offenders. Many of them were qualifying for probationary sentences rather than incarceration. So the use of community-based intimate partner violence treatment programs did become a more frequent response and a more frequently used treatment method. There are a wide range, but one of the most mainstream modes of treatment right now throughout North America is the Duluth model, and this is arguably based on a feminist reference point and was initially developed primarily for white heterosexual males. It concentrates on psychoeducational and cognitive behavioral therapy that focuses on intimate partner violence as stemming from patriarchal belief systems that have taught men to use controlling and abusive tactics against their partner. Some studies on the success of these kind of treatment programs do suggest that results are mediocre at best. And for programs that rely heavily on one particular form of intervention, they might not have great results because they're neglecting to consider the inclusion of participants that come from various types of relationships or different cultural backgrounds. So this could essentially undervalue any alternative needs that minority and diverse populations might require. Researchers have suggested that improvements could be made by modifying programs to include treatment that's suitable for all types of intimate partner violence offenders, as well as taking cultural differences into consideration to provide more individualized and effective treatment. It's important to note that even though there's not a great deal of it, a lot of the research that has been completed on the effectiveness of treatment programs with minority populations has largely been conducted in the United States. So I was interested to see if similar themes emerged within a Canadian context. So I was looking at what challenges or useful strategies are there in the current administration of these programs with members of various cultural groups throughout Canada. And I will get into which groups specifically, but my question really is centered around populations of diverse race and ethnicity. As I believe is the case with the rest of the presentations today, this study did concentrate on the data that was collected during phase 2, which was with key informants who work in the field. And I specifically accessed interview data from two groups. So the first were service providers who worked in the correction sector. So these were either probation or parole officers, and also identified that at least part of their role was to make referrals for their clients into these kind of treatment programs. The second group was informants who were facilitators of these programs, and they were classified as partner assault response. So within the interview itself, the service providers were also asked to identify which vulnerable population they worked most often with. And so I also selected interviews if they indicated that they worked with either or both Indigenous and immigrant refugee populations. And so all of that considered, I ended up with 26 interviews that met all of this criteria and was used for analysis. So because I was interested in seeing if results from the United States could be replicated, I used a deductive approach, which was to identify themes in the literature and then see if these same topics were things that service providers here were also talking about. One of the major themes is around challenges in administering treatment programs with minority populations, and what prior research has suggested is that there might be higher rates of program dropout, a lack of culturally sensitive approaches within the treatment itself, and participant adversity to the judicial system. So I was looking for those. I was also looking for the identification of any useful or helpful strategies, which researchers have also suggested could include the prevalence of shared offender and facilitator demographics, recognizing that participants attend programs with personal traumas and stress that need to be addressed, and also the programs being able to use culturally focused treatment where possible. So these were all of the specific themes that I was looking for within the interviews. So I'll spend some time going over the results. What I have for you on the slides here are various quotes to support the findings that I'll talk about more in depth. I personally always find that quotes are a little bit more interesting to look at, so hopefully you feel the same way. But the first theme regarding program dropout didn't really yield many results in this sample. Only one of the 26 interviews specifically mentioned a lack of attendance, but this was due to the participants' concern that they might be recognized because they were in a smaller community. In terms of adversity to the judicial system, 7 of the interviews talked about this. Observations that they made included discussions about participants dealing with negative experiences or historical discrimination from law enforcement, as well as a lack of trust with the criminal justice system or other authority figures. The informants also alluded to negative experiences with corrupt law enforcement in countries of origin, as well as the overrepresentation of Indigenous populations in our current criminal justice system. The discussion around a lack of culturally sensitive approaches was the largest finding pertaining to the challenges. Half of the service providers did mention a lack of culturally sensitive approaches, and some examples they gave were that program materials were not always available in all required languages. There might be difficulty in providing an appropriate translator, and the content wasn't always catered to Indigenous participants, which sometimes resulted in them having to seek culturally specific programs in outside communities. And as the literature mentioned, one of the perceptions of the Duluth model, for example, is that it is centered around a white heterosexual framework. So I also thought it was really interesting to mention that one of the informants, I think it's the last quote you have there, specifically identified that their program was very white. Whether they meant that in terms of the participants they work with or the content of the materials they were using, I'm not quite sure, but clearly referencing a lack of diversity that could pose a challenge for someone attending from a more diverse population. And now on to some of the more useful strategies. So 5 of the informants mentioned that there was a positive impact when they had a shared offender and facilitator demographic. So service providers who spoke the same language as their clients, if they were immigrants themselves, or if they had the same or similar heritage, racial, or ethnic background, identified positive experiences, especially when it came down to establishing rapport with their clients. And also a large finding, there were 15 of the service providers that recognized the importance of acknowledging situations that might have occurred in the participants' country of origin, as well as the possibility that the participants could be experiencing post-traumatic stress. There's a prevalence of intergenerational trauma, and also a strong impact of residential schools and histories of colonization. So even though there were a lot of examples of how programs were lacking in culturally sensitive approaches, service providers did also describe ways in which they were trying to modify things to at least try and be more inclusive. So some examples here, they talked about incorporating elders to come and speak to their participants, incorporating more mental health and substance use components where necessary, referring participants to programs that included culturally specific information, or combining their treatment program with a secondary counseling or other community program that could address any additional needs. What I should also mention here is that it did also appear that the service providers who were able to incorporate these additional resources into their programs were located in areas that had much higher population counts, so likely had access to more services than those living in more sparse or rural areas. And so if I may take a minute, I did want to briefly talk a little bit about my doctoral research, because I am thinking I'm getting a few results from this that really tie in well with this other project. My doctoral research is currently outside of the CDHPI, but I have been continuing to do surveys and interviews with intimate partner violence treatment program facilitators for programs that are connected to a specialized domestic violence court. I have been asking specific questions about how programs work with participants from minority populations, and I'm still hearing that programs are designed to be culturally neutral. that they don't really incorporate a lot of diversity, and that's so that they can make it accessible to the largest amount of people. But what I've also been finding is that, at least for the programs that are connected to the courts, when there are barriers in place that might prevent a participant from doing well in a group setting, they're often transferred out and get the materials through a one-on-one session with the facilitator instead. On one hand, this does appear to be a way to try and accommodate the participants' needs without having to just eliminate them from the treatment completely, which, as it looks, it seems fair. But looking further into which participants this might actually apply to, some of the more frequent reasons why somebody would be removed from group are due to things like if there's a conflicting cultural belief with other group members, if there's a strong language barrier, if the participant has safety concerns regarding their gender or sexual identity, and as well if the participant is female, this also happens, and it could be because there aren't always as many programs for women as there are for men. I think almost, if not all, of the facilitators that I've spoken to also stress that one of the most beneficial elements of their treatment program is the peer support and encouragement that participants get from the group format. By doing this, they see that they're not alone in their struggles. Other people have committed the same kind of abusive behaviors they have, and they can gain a lot of support from each other and hold each other accountable. This is very different from individual sessions where it's just the participant and the facilitator. There's a shift in the dynamic, and it becomes more of a student-teacher kind of relationship as opposed to something more collaborative. So not only are participants who are already at a greater social disadvantage more likely to then be referred out of a group if there are barriers, they're also not getting the benefit of peer support that facilitators have stressed is one of the key things and one of the best things about programming. So to go back to the CDHPI research, there are limitations to this study that I did because it was secondary analysis, which does prevent me from revisiting interview questions or getting clarification from any of those service providers. But while the original interview questions were not designed to ask primarily about intimate partner violence treatment programs, using interviews from service providers who work with the programs or supervise offenders as they're going through it, it was anticipated to elicit responses from this perspective. And I think, considering the results of my doctoral research as well, where I was developing those questions, we do see some overlap in the challenges that programs have in providing more culturally sensitive approaches. Overall, we also do see consistency with the themes identified in the literature that came out of the United States, with various challenges and strategies in a Canadian context. For the most part, these topics were talked about, and of course, there might be many more things that I wasn't able to identify because I was just looking for those pre-existing themes at the moment. The service providers also often recognize that participants do attend programs with personal traumas and that they might also need to use services from outside sources to supplement their program. I believe this is reflective of the need for strategies that incorporate a more in-depth contextual understanding of the participants and why they might have used violent behaviors or what they need in order to continue to refrain from using violence moving forward. And so far, many of the programs don't appear to be able to address these things solely on their own. And lastly, I do believe that results are supportive of the literature, as we've also heard today that a one-size-fits-all approach doesn't always work. And in this case, it might undervalue the needs of minority populations. Whether or not additional resources were readily available, the fact that they were consistently viewed as necessary does highlight for me that the current standalone approaches are not providing enough support to participants who don't fit the mold. And we are also seeing in my doctoral research as well that they might even be removed from the group and into individual sessions when they don't fit well into the existing format. So I will leave it there. I did post a few references from the literature if anyone's interested, and I will be around for a breakout session later today if anyone has questions or wishes to continue discussion about this. Thank you.